I'd like to introduce Amanda Lydon, who's probably known to quite a lot of you, MS nurse specialist with the Hunter New England Local Health District. And Amanda will briefly run through some services that are available for you to connect into.
What do I do? Nicola keeps saying briefly. I think my reputation has preceded me because everyone, or most of you in this room, know that I like to talk a little bit. My brother says I have a mouth like a torn pocket, so not nice, is it? Okay, so I was here, or I'm here to tell you who we are and what we do. And I think really, I don't know, I think I'll be preaching to the converted because there's very few unfamiliar faces here. So I'll be very brief. Okay, so you've already seen this slide today. That's our team. Looks like we've got a cast of thousands, but our resources are a little bit finite. Our team has grown exponentially over the last few years, but so have our numbers. So Jeanette said to you we have about 1,046. I know because I put them into IMED, or all of you into IMED. We used to have, when I first started in 2008, about 300 odd patients. So that's how much we've grown in the last few years. You may not know all of these people, but you've seen a lot of us here today modelling the lovely red shirts. Sean up the back hasn't got one. How did you miss out? You can have mine later if you like. You will meet some of these people through your pathway with us, but you may not meet all of them because a lot of them work in the lab or behind the scenes. There's a very integral person there, and I don't know how to work the pointer, but she's not here today, and that's Summer, our beleaguered receptionist who helped promote this day and get you all to come along. I'll talk a little bit more about Summer in a moment. The other person that's not here today and sends her apologies is Susan, our other MS nurse specialist. She's actually in America at a conference, lucky her. Okay, so I've just got a very brief slide there about the sorts of things that we can do for you. We may not do all of these things. We're there to help with your diagnosis. We help with relapse management. We make referrals for you if necessary. We can give you advice about your treatment and the management of your treatment and the side effects. It's often Susan or I that will work with you with that. Jeanette will see you for the half an hour and you may or may not have an appointment with us later or at a later date. We help with your symptom management from the therapy because, as Jeanette said earlier in the day, a lot of the treatments do have side effects, so we can help you through that process. We can give you lifestyle advice, and Cassie's given you a lot of very good lifestyle advice today. And has reinforced a lot of what Jeanette's probably already said to you at times when you've come to see her. We can help with education, advocacy. We do a lot of work in that respect, and Jeanette spends a lot of time, and Armin, writing letters and advocating for you. We have new patient advocates, as you heard today, and Summer over here has asked me to mention that if you want to talk about this questionnaire or have any questions, please see her or give her your contact details afterwards. We also, as you know, do lots of research, and some of you probably get very tired of me hounding you or getting you to sign 55 million forms. You give a lot of blood, so we do thank you for that, as the other participants have said today. This little model here, the reason I've put this up is that you, as the people with MS, you're the most important people here, but also there are other people involved in your care planning and your life, particularly your carers. So what I wanted to get across to you is that Yes, we're the specialist clinic, but we are only one cog in the wheel. So I want you to remember that there are other people like the MS Society. Oh, not the MS Society anymore. I've been through a lot of reincarnations over the years. You know, MS is there to help you. Also, another important cog in the wheel is your GP. So please, I'm trying to think who spoke about it earlier, that if you have questions or you're feeling unwell or there's a problem, it's not always your MS that is the problem. So don't forget your GP in this process. Your GP is a really important link. We'll try as much as possible to answer your questions if you have questions or you think you're relapsing, but we can't help you with all things. So don't forget that, you know, there are other people that can help you, and you've heard a lot about the services that are out there today, and there have been services sitting out there in the foyer that are there to help you, like NDIS and all of those people. Okay, and so the last thing, and I said I'd be brief, is that there are our contact details. We are there 5 days a week, but we're not a 24-hour service. So when I mentioned summer before, we've had a lot of comment made back recently that we can never get on to you. No one ever answers the phone. I think the problem is the phone never stops ringing, and so it's often engaged. And we have a bit of a problem with our message bank recently. So, please be mindful that someone will try and get back to you, or one of us will try and get back to you, but we can't always do it in an extremely timely manner, but we will get there. That's why I've got the email address there. So most of you should have that, but if you don't have that, that's always a good way to contact us, because there's always someone, well, 5 days a week, and often some of us look on the weekends, but that will respond to that email, because one of the members of the team will respond to that. So that's sometimes can be a good way to get to us. So thank you all for coming, and thank you very much to MS for supporting this day.
Thanks, Amanda. And we've spoken through the day of the services available with MSL, and of which there are many, and some of which will complement the Hunter New England Local Health District too. So just very briefly, we provide a lot of education and wellbeing programs, webinars, wellness lunches, community days. We do a camp, a community camp retreat as well. We have online programs, podcasts, recordings, and a symposium each year. And here's just some photographs from some of our programs. As mentioned, we're an NDIS provider. We've talked about peer support. I've mentioned employment support services as well. And so the gateway to all of our services is through the MS Connect number. If you call this number, you can speak directly to an MS nurse specialist, a continence nurse, a social worker, an MS expert. So maybe to take some of the traffic pressure off Amanda's service, you can always call MS Connect as well for that support. So you've had a lot of information today, and I'd like to hand over to MSL's CEO, John Blewonski, for the final word.
Thanks, Nicola. It's not often I get the final word, so I'm very pleased. Thank you. And look, there were 3 words that came out of Uncle Bill's welcome to country this morning, and quite a lot of words, but 3 in particular. That was that sense of community, the sense of passion, and that sense of positivity. And I think today we've seen that in so many manifestations of what the speakers have presented, the exhibitors outside, the volunteers have brought, and in your participation. I couldn't help but wonder whether my observation, at least this afternoon, is we got much better at our exercises than we were this morning. And I don't know whether that's down to Ryan or the fact that Dr. Cassie was still in the room. So I've taken away an enormous amount of stuff that I want to digest over the next couple of days, because it's been really exciting to hear some different perspectives on how people, live with MS and are enabled through that. And I think the positivity is something that really resonates with me. Nicola's done most of my job by running through and telling you all the wonderful things that MSL can provide, but I do encourage you to use MS Connect as your gateway into information, and regardless of who that provider is, I think what you've got there is a community ready and able to respond to your needs. If we can't offer it, if we can't provide it, we'll find out. And I think that's an undertaking that all of our staff would abide by. There is no question that an event like this, as professionally as it has been put together, can be put down to one individual, but it's needless to say, Nicola, while being MC, has propped and primed me certainly for the best part of a month in the lead up, but together with the rest of the MSL team, I just wanted to thank them for the enormous work that's gone on behind the scenes. Of course, our volunteers today and in the lead up to the event, our ambassadors. I also want to call out particularly our media team, Shay and Lorna, have done an enormous job. One of our objectives behind today was to provide education to the wider community about MS and the fact that many of the symptoms that you experience of living with MS aren't able to be seen by others and understood. Was one of the challenges that we tried to communicate that, and our media team have done an enormous job in garnering all sorts of radio and press and television. I know there's lots more going on this evening, so look out for that. I think you should be proud to be part of that MS community that's now trying to generate the positivity of that story, but helping you communicate to others what it is to live with MS. I have left the most important group to last, and that's you. And I want to thank all of you for making your time available to come and participate in this event. I was going to go through the wellness wall takeouts, but it was rather poorly constructed, Nicola. But the sentiment was there in terms of people being able to have their own takeout from the event. And I'm sure as you make your way home tonight that you'll sort of digest a bit of that, but there'll be one or two things that really will resonate with you and have made today important. So thank you for giving that time, and I hope the experience leads you to know that you're not alone. There's many people out there working for you and alongside you to help your life with MS be as best it can be. So thank you all for participating and coming along.